Hi, I'm Dr. Ramesh along with Dr. Adarsh. Today we'll be demonstrating few of the low back stretches that can be used by patients who are in the recovery phase with who are suffering from IBDP cases or suffering from sacroiliac strains or anything that causes a sciatic nerve pain. All those people can do these stretches in the recovery phase. Remember, not during the pain phase. Once the pain is waning down, at that time they can go for these kind of structures and partially strengthen the, because active exercises are there. These ones will be the upper body weight will be completely on the bed, and this will help in initializing the mobilizing part of muscles in that area. So first one we will be demonstrating will be a knee chest hold position that Dr. Adas will demonstrate. He will be bending the knee and bringing it close to the chest, raising the head and holding it. Actually, at this position, a very good stretch happens at the low back area. And remember, this need to be held in position for 10 seconds. Like you count like 1001, 1002, 1003, 1004, like that you count. And in 10 seconds, you can release it. Remember, pain is like a signal. If you have pain, don't exert or overexert. Remember, many people have a tendency to go back to the active lifestyle as soon as possible. That is not at all possible in low back conditions. So please have a graduated way of increasing the stretch part. Now, if how much ever possible, suppose if you can do only till here, this is enough. Don't do too much. If you can do bit more, that over a period of a couple of days, we will be able to attain a position, attain a stretch that will be sufficient enough. Okay. The second stretch that we are going to do is like this. We'll ask them, we have to fold one leg. Okay. Then the other limb will be raised with a straight knee. Remember this one, with a straight knee. And the hands of the person will be holding below the knee and raising the head part. Now this is a stretch. Now there are people who can come and touch and all that, but initially, even if it is this much, that is okay. Now remember, the knee is bent on the other side. If you do a with the straight leg, this one will become even more stressful to the person who is doing it. So remember that one. This is the advanced version. So you can do with a flexed knee or a folded knee initially. Okay. After doing on one limb, please repeat on the other side. This one also you need to hold it for 10 seconds. Remember the count 1001, 1002, 1003. That like that you count, or whatever way you can. If a timer is there, that you can use also. 10-second hold and release it. The third stretch we are going to do is with both the limb raising at the same time. Now, if this much is possible initially, that is enough. But the final part, how we will be doing is, we will be raising it till the amount, raising the head also, and interlocking our palm at the back of the knee. And this is the final stretch that we will attain. Now this can be done at maybe after starting the initial stretches. You can do it after 3 days or 4 days. You can attain this position. This is well and good. Okay. This is the fourth stretch we are going to do is called as piriformis stretch. And the way it is done is like this. Now, fold one knee to 90 degree. Then fold the other limb and cross over above the other knee and keep it like this. Like one leg over the other we usually keep. Now with the other, with the hands, we'll be holding on the other knee below and we'll be pulling it towards us. Now, when you do that, there will be a huge amount of stretch that will be happening at the back of the body. Okay, this is called piriformis stretch. These 4 exercises are to be done by a person who is in the stage of recovery. Remember, again I am saying, at the stage of recovery only. In the initial phases, if you start to do this, it will cause excruciating pain, which is unnecessary at that point. So remember, at the recovery phase, you start with these 4 passive exercises in a way, because upper body is completely, the weight is taken up by the bed itself. The rest. So, whatever I am saying right now is for a common man's point of view. So, that's why the technical jargons and all that I haven't used to the minimum. But remember, these are just a basic stretch. Advanced varieties, multiple versions of it are available. You can search and find out also. But for my patients, I usually advise these stretches. We'll be coming up with an advanced version of this stretches in a coming up video.